You start Ozempic, your appetite drops, the scale finally starts moving, and then, a few weeks later, something else starts changing too. Your hair. Not in one dramatic movie scene, just more strands in the shower, more in the brush, more on the pillow. Enough to make you stop and think, wait, is this the medication? So is Ozempic actually causing hair loss? Or is something more complicated happening underneath the surface? This is not medical advice. Consult your doctor. Here's what the evidence suggests. When people hear hair loss on Ozempic, most assume the drug must be directly toxic to the hair follicle. That is not what the current evidence clearly shows. A more plausible explanation, in many cases, is something called telogen effluvium. Telogen effluvium is a form of diffuse hair shedding that can happen after the body goes through a physiologic stress. That stress can come from illness, surgery, high fever, childbirth, or significant weight loss. Instead of creating one specific bald patch, it tends to shift more hairs than usual into a resting and shedding phase. The result is often not dramatic patchy baldness. It is more often a general increase in shedding, and that fits what many patients actually describe. Not, I woke up with one bald spot. More like, my hair feels thinner, my ponytail feels smaller. There is hair everywhere, and now I am annoyed by my own shower drain. I'm Dr. Kim, a licensed physician, and in this video, I'll break down why hair shedding can happen after starting Ozempic, what the research suggests so far, why this does not affect everyone the same way, and when it deserves a closer medical look. So why might Ozempic be linked to hair shedding in the first place? The first major explanation is rapid weight loss itself. The body does not always interpret rapid weight loss as a stylish health optimization project. Sometimes it interprets it as stress. And when the body is under stress, hair growth is not exactly the first priority on the budget. This is one reason many experts suspect that the shedding is often related less to semaglutide as a direct hair toxin and more to the physiologic consequences of losing weight quickly. That idea also lines up with what we see after other major metabolic changes, including bariatric surgery. The second major explanation is reduced nutritional intake. This one is very important. Ozempic can reduce appetite substantially. That is part of why it works. But when food intake drops a lot, nutrient intake can drop too. And if intake becomes too low during active weight loss, hair cycling can be affected. Protein matters, iron matters, zinc matters, vitamin D matters, energy intake matters. That does not mean every patient on Ozempic is quietly becoming deficient in everything. It means the risk becomes more understandable if someone is eating much less, skipping protein, tolerating only a narrow range of foods, or losing weight quickly over a short period of time. And this is where the picture gets more complicated. Timing matters. Hair shedding from a physiologic stressor is often delayed. That is part of why this side effect can be so misleading. A person starts Ozempic, then loses weight over several weeks, and only later notices increased shedding. So the medication becomes the obvious suspect. Sometimes that is fair. But Ozempic gets the blame when the real trigger may have started weeks earlier. But there is another layer to this. Not all hair loss is the same. Diffuse shedding is one thing, patchy hair loss is another, hair breakage from styling damage is another, a slowly receding hairline developing over years is another, and an autoimmune process like alopecia areata is yet another. Each of these has a different mechanism, a different prognosis, and a different set of appropriate responses. If someone already has androgenetic hair loss, thyroid disease, iron deficiency, a recent illness, postpartum shedding, or another cause of hair change, Ozempic can get blamed for a situation that is actually more complicated. That is one reason the Ozempic hair loss link can look simpler than it really is. Now, does that mean Ozempic is innocent every time? No. That would also be too simple. There are enough reports to say the association is real enough to take seriously. But serious does not mean fully explained. A useful way to think about it is this. Ozempic may be associated with hair shedding in some people, but in many cases, The shedding may be driven more by the biologic consequences of treatment, especially rapid weight loss and reduced nutritional intake, than by a simple direct toxic effect on hair follicles. That is a more accurate explanation. It is also less dramatic, which is unfortunate for social media, but helpful for reality. Now let's talk about who might be more vulnerable. People losing weight quickly, people eating very little, people with low protein intake, people who already have low iron stores or other nutritional issues, people with underlying thyroid problems, and people who were probably heading toward hair shedding anyway, but only noticed it once they started paying very close attention. Because once you worry about hair loss, you suddenly become a part-time forensic investigator of your own sink. Every strand starts feeling like evidence. Every shower becomes an audit. Some patients assume that if hair shedding starts, they must stop the drug immediately. That does not automatically follow. Mild diffuse shedding during a period of rapid weight loss raises a different level of concern than sudden patchy loss, scarring, or major scalp inflammation. In other words, "my hair is shedding" is not the end of the clinical conversation. It is the beginning of one. So when should hair loss after starting Ozempic be taken more seriously? If it is patchy rather than diffuse, if it is rapidly progressive, if it is accompanied by scalp rash, pain, or inflammation, if there are symptoms suggesting another condition, such as thyroid disease or severe nutritional deficiency, or if the shedding is severe enough that the treatment plan needs closer review. On the other hand, if the pattern is diffuse shedding during a period of significant recent weight loss, telogen effluvium becomes a more plausible explanation. And telogen effluvium is often temporary. That word matters, often, not always instantly reversible, not emotionally convenient, but often temporary. So what should you actually do if this happens? First, do not assume every case means the drug is directly damaging your hair. Second, look at the pattern. Is this diffuse shedding, or is it patchy? Is it gradual, or is it rapidly worsening? Third, look at what else changed. Was the weight loss rapid? Has food intake dropped sharply? Has protein intake fallen? And fourth, if the shedding is patchy, severe, fast-moving, or happening with other unusual symptoms, that is a much better reason to get it evaluated than panic alone. Because the practical question is not just, is hair falling out? The practical question is, what kind of hair loss is this? What changed before it started? And does this look temporary, or does it need a closer workup? Those questions are more useful than panic. The fuller story is more likely to involve the physiology of rapid weight loss, nutritional stress, and altered hair cycling than a simple claim that Ozempic directly causes baldness. Understanding why it happens changes how you respond. It changes whether you panic or investigate, whether you stop treatment immediately or have a more productive conversation with your clinician. That is the difference between panic and understanding. And understanding always leads to better decisions. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.